terms of risks with dermal fillers, it can be something as mild as maybe you don't like the way the product looks, there's a small amount of migration, or on the complete other end, the most severe intravascular occlusion and necrosis in the area. For dermal fillers, again, you want to go to a physician-owned and operated med spa where you come in for a consult, you're properly evaluated, they explain to you the risk versus benefit, and then if there is a complication, it's identified immediately and treated immediately. If there is a severe event like an intravascular occlusion, it is imperative that it is recognized immediately and treated immediately. This is not something that can wait till the next day. This is not something that can wait several hours. It needs to be identified immediately and treated immediately. So there's several different techniques we have that can hopefully dilate the blood vessel and move the product on through. If those techniques are all ineffective, then we may need to inject hyaluronidase, which will break up the hyaluronic acid so the patient is able to dissolve the hyaluronic acid and save the tissue, so it's healthy tissue. When a patient comes in for dermal fillers for the first time, there are some minor side effects that you can expect. Bruising, bleeding at the injection site, those are the most common. We often will see patients with small bruising, although you can get a more severe bruise. One thing that is nice about our facility is we do have a BBL or IPL machine that can disperse the bruise, and if someone has a severe bruise and it can be appropriately treated depending on the area, we offer that complimentary, so they're not running around with concealer for 2 weeks. But that would be the most common, would be bleeding and bruising. Occasionally, a patient may have a medical condition where they reject the hyaluronic acid. It may be injected into a deeper plane, move much more superficially. I've seen this with patients with autoimmune diseases like lupus or maybe rheumatoid arthritis. If you identify that in a patient, not that it's a complete contraindication, but we usually try to counsel the patient ahead of time that they may have some issues. The chance of needing possibly hyaluronidase for the product to be reversed is a higher probability than the average patient. Occasionally, I will have patients that come from a different med spa, either out of state or they were somewhere here in town and the product migrated. I usually recommend that they go back to the person who injected them, just because unfortunately hyaluronidase is quite expensive. We have a patient who is seen elsewhere. We would have to charge them if they come here for their product to be dissolved. But occasionally, I do have patients that it's been years since they've had an injection. They may have hyaluronic acid that's still around 2 or 3 years later. They're from another state. They can't go back to where they came from. So we may have to dissolve that for them. And I would want to dissolve the product if it's look like it's migrated. What I don't want to do is try to inject on top of a product that was incorrectly placed and try to even it out. It's much better to inject with hyaluronidase, start from a fresh canvas, and then we can inject the patient appropriately.